Hi, I'm Hannah. I'm going to be performing a wound dressing. So I'm just going to provide privacy. I'm going to come in, I'm going to verify my patient. Hi, I'm Hannah. I'm going to be changing the dressing on your wound today. Can you tell me your name and date of birth? Okay, great. I'm just going to double check that with the wristband, and he is who he says he is. Are you in any pain today? No, that's great. Okay, if he was, I would have administered pain medication 30 minutes ahead of time. So now I'm going to perform hand hygiene. Throughout the whole video today, we're going to be using hand sanitizer. I know I would, not in the field, I would use soap and water, but because we have a limited amount of time, we're just going to be doing hand sanitizer. The first thing I would do is I'm going to put on clean gloves, and I'm going to inspect and change the dirty dressing. So I'm just going to pull this up. Making sure I leave myself enough room here. I'm going to remove this AD pad. I'm going to pull and hold at the skin so I prevent the skin from tearing at all. I'm going to discard this. Opening my chuck and leaving this here so I have an area to put my trash. I would also inspect this pad for any drainage, which there is none. I'm going to remove these pads, checking for drainage again. And now I'm going to remove the gauze pads inside the wound, noting that there was 2 gauze pads inside and 2 outside. Now I'm going to inspect the wound. I'm going to inspect the color, the type of wound, any drainage that's coming out. I'm going to palpate the area for any bogginess. Good, there is none present. And now I'm going to measure the wound. First, I'm going to take my sterile. I'm going to measure the depth, reaching in, and I'm going to measure it against my tape measure, which I'm going to use tape as a demonstration. So I'm going to draw it out. Okay, that is about 1 inch. Now I'm going to discard this. Now I'm going to take my tape measure, and I'm going to line the wound. Okay, that is about 5 inches. Oh, here it is. Okay, great. That is 6 inches in length, and it is 1 inch wide. Okay, and I'm going to document that. Okay. Now I'm going to set up my sterile field. I'm going to open my package away from myself. Okay, discard this. Before I set that up, I'm going to be taking off these gloves. Again, performing hand hygiene with soap and water, but we're going to use a demonstration of an alcohol today. With this touching only what is going to be the outside, using my 1 inch border and laying it down. I can touch anything that's going to be the outside of the package, and again I have a 1 inch border set up. Now I'm going to touch the outside of my pan, and I'm going to dump everything inside, keeping it inside the 1 inch border. If I didn't touch a 1 inch border outside, that would be considered non-sterile. Now I'm going to check time, date. If this was opened, it's unopened, so I'm going to keep the label in the palm of my hand, and I'm going to take off the cap, and I'm going to lip it. So I'm going to just empty out the top of the liquid around the edge so that settles the outside, where I'm going to pour it into this container now. Okay, I'm going to put this on right away to prevent Nick from getting contaminated. Now I can put on my sterile gloves. So I'm going to open this package away from me, discard of that, keeping it important to not turn my back in the sterile field. I'm going to open up these gloves. Okay, good. And for the first one, I'm going to touch only what's going to be the inside. Okay, good. Now I'm going to touch what's going to be the outside of this glove. So sterile is touching sterile. Everything is working out. Now I have 2 fingers in my pinky, but I can adjust this because now both hands are sterile. Good. So now I'm only going to be touching sterile. First what I'm going to do is I'm going to clean the wound. So first, moving this closer to myself, I'm going to start at the top, go from the outermost edge, down. Now the other side, throw away. And now the inside with a circular motion, and discard of that. I'm also done with this now. Okay, now I'm going to take my gauze, open it up so I can absorb the moisture, drop it in my saline, open this up. Drop it in. Okay. So this is the part of the procedure where one of my hands is going to be clean and the other one is going to remain sterile. So I'm going to take my forceps. I'm going to make sure this is soaked. Okay. Using my non-dominant hand, I'm going to remove the extra moisture, keeping my forceps sterile. I'm going to get a good starting spot. And I'm going to slowly insert this into the wound. I'm going to make sure that this gauze is not touching the skin, that it's only going into the wound to keep it clean. Okay, now I'm moving on to my second. Again, this left hand is non-sterile now, it's only clean. And I'm going to feed it in again. Making sure that it's not touching the skin, and it's only going into the wound. Good. And now I'm going to put, still using on my right hand, I'm going to put 2 gauze pads on top. And the AED pad, and I'm going to put the blue line up in case this patient has to go for an x-ray. And now it's clean technique, so I can touch this tape with both hands. I'm going to name, initial, and date it in time to make sure that those people know that I was the last person who changed this wound. Use this tape. I'm sure go ahead and take off these gloves now that everything is done. Okay, making sure that I've named it and initialed it. I'm going to cover up the patient again. I'm going to discard all my materials. So I'm making sure the bed is in the lowest position. I'm going to put up this side rail. And I'm going to perform hand hygiene.